Hey guys, first and foremost, thanks for the shares and the likes on my last video. I've had a few of you guys ask me, could I have endometriosis? Do you think I have endometriosis? And there's no easy answer outside of the surgery room. But I wanted to take a couple minutes to explain to you the signs and symptoms. That way, if you want to get a diagnosis, you have a more clearer understanding of the disease and its pathology. There is a lot that deals with this illness, so I will be doing a series of videos because trying to get all that information in one video is just going to be way too much. So the first video we're going to be doing is going to be on pain, since this is your primary and most dominant symptom you're going to be dealing with from the start to when you pass. It's going to start off as a light pain, generally normal for a cycle, around your cycle, and it'll turn into a more intense pain that will end up being daily for you. And it'll change for the time, what you're doing, and the area that's affecting. So let's get into that. First and foremost, you're going to have your ovarian pain. Now, mind you, dull aching pain around your time of ovulation is completely normal and is all right. But any pain that stops you in your tracks, stops you from breathing, and is continuous, stops you from sleeping, is not normal in any way, and it really should look into. If you're having sharp, intense pains with a almost popping feeling, I would go seek a doctor, as this could be a cyst or a cyst rupture, and this could do some damage that could be addressed by a doctor in the surgery room. Next to that, you're going to have your tubal pain, and this can be serious, as twisting and blockage is common with endometriosis, and this can cause more serious problems if you are pregnant or trying to become pregnant. So tubal pain, again, something that should be addressed right away with your doctor. Your most dominant pain source is going to be your uterus. It's going to be internal and outside of your uterus. And by that, what I mean is you are literally going to feel the outside shape of your uterus and tearing and pulling on it. The best way to describe endometriosis pain is you have barbed wire covered in acid growing inside of you. As it grows, it's going to attach to new spots in your reproductive system, to your GI tract, and onto your actual abdominal wall. As it does this, it's going to pull and move your organs, as well as bleed monthly with your cycle and slough off, creating new tissue and growths as it goes along. Unfortunately, this does cause a lot of inflammation, and you're going to get swelling in your belly and your abdominal lower pelvis area, and that swelling in turn is going to cause pressurized pain. Touch, movement, all these are going to be sensitive to you. Unfortunately, there's no getting around it. It's just a part of it. The next symptom with that is going to be your rectal and colon pain. This is going to be around your period, as well as every day with sex, with uterine cramps, even with everyday movements and bowel movements. Yes, this will make bowel movements extremely unpleasant, and because of the nature of the growths, it will change your bowel movements completely, and we'll get into that in another video. It will also cause rectal pain with insertion into your vaginal area, so sex will become a little bit laborious. All these pains that I've mentioned before are common to endometriosis and in no way normal for regular cycles. You should document them, keep a journal, so that way it's easy for your provider to diagnose what's going on. Now, there are some more serious pains that I've left to the end because they need to be looked at right away and not pushed off. There are fatal forms of endometriosis. contrary to common belief, it will move up into more serious functioning organs. If you have any of the pains I described before, as well as shortness of breath, a change in your breathing pattern, a change in your heart pattern, pains in your heart, pains in your lung, and pains in your diaphragm, you need to seek immediate medical attention, as this can be fatal. I hope you guys have enjoyed my first video. They're gonna get better. I'm new at this. But if you have any questions about endometriosis, please shoot me a line. I am an open book and I am more than willing to answer any questions you guys have. Hope to see you soon.